Third patient today that we're doing filler on the hands. Other patients were a good bit older, but here we have someone who's just starting to get some of the structures in the hands becoming visible. Front top of the hand looks really good, but look, as you get towards the fingers, see more prominent tendons and the veins coming out, starting to look a little bit older. So what we can use is a product. I like to use Radiesse usually, basically putting it in as leveling compound. And what we do is just with a couple injections here, I'll probably just use 2 or 3 and then massage it around, and it just goes into the lower areas. We can't get it just right today because it'll actually get best as she moves her fingers over the next day or so. So her body will sort of get this to find the grooves by itself. So I'll show you how we do this here. Find a couple of the lower spots. Here's one here. There's a couple ways. One, I can sort of tent up the skin, and all I'm doing is getting under the skin, and I'm more or less just putting in a blob or so of the filler. And then we'll do it in a couple other places, but I'll just show you this spot right now. And then when we sort of massage it out, it goes sort of, can you see how you don't see the veins, the vein that was there as much? And as I continue, you can see how it sort of went in between the tendons. Now I'll just continue massaging it through those areas, okay? So I'm gonna do the other ones, and I'll show you a picture in just a minute. All right, so you can see where I put the filler. That's half on each hand. And all I'm gonna do is massage. I won't do as good of a job as she will over the next day by moving and moving and moving, but I'm just starting to work it. You see how I just push some like a snowplow down there? And we'll just continue to work it out. It's kind of like putty, but I like to think of it as leveling compound. Make a fist for me. And sometimes that even helps to smooth it out. You see how that's getting smoother? You can see that, right?
Yeah.
They're working, thank you. So there you go. And then she just keeps making fists just throughout her normal activities. Open up a little bit. You see it just gets smoother. That part's smooth. I'll just work on this a little bit. So that's all there is to it.